Right, I think we'll get kicked off now, because I can see quite a few folk have now managed to join. So we're sitting currently with 34 and a few more still expected. So just to say thank you so much to everybody who's taken the time to come along today in the first of what we hope will be a series of webinars over the coming year. By way of introduction, my name is Jackie Stevenson and I'm a Programme Manager here at Health and Social Care Alliance Scotland, and I'm here with my colleague Alistair Bruce today to coordinate the session and hopefully keep us to time. So the aim for today is to tell you a wee bit more about some of the long COVID services in Scotland and importantly how to find out some more information about those services. So today we're going to hear from Professor Edward Duncan from University of Stirling, and he's going to tell us about some research that they've undertaken to scope and map some of the long COVID services in Scotland, and also joined by my colleague Cameron McFarlane from the Alliance, who's going to tell you a wee bit more about the ALISS online platform and how that can be used to source health information about various topics, but one of which will be long COVID. So housekeeping wise, we're using a webinar format today and we hope to finish within 1 hour. We are recording the session today for anyone that can't make it, but just to assure you, we are using that webinar format, so none of you guys will be on screen, just our good selves on the panel. We will have some time for questions built in between the presentations and at the end, so feel free to use the Q&A function at the bottom of your screen. Just add any questions that come to mind during the presentation, feel free to ask, and we'll pick up as many questions as we can. It's unlikely we'll get through all the questions, but we will make effort to get a response to all the questions and we'll feed that back after the event. Also encourage you, if you want to use the chat function, quite a few of you already are, feel free to do so. All that we encourage is keep any comments respectful. And so without further ado, I would like to welcome Professor Duncan from the University of Stirling, who's going to kick off today's discussion. So Eddie, over to you.
Hi Jackie, thank you very much and good morning to everybody and thank you for joining. Although we can't see you, it's great to be together and look forward to presenting the work that we've been doing over the last couple of years and building on other work around long COVID, which has been going on for longer. I can't see the chat because if I do, I'll get distracted. But Jackie's going to keep an eye on Q&As and we can pick up on these issues when we've got time for discussion. So I'm going to share my screen and hopefully you will be able to see that. Jackie, can you let me know if you got it, or Cameron, you're nodding there. We've got the title right there. So fantastic. So the presentation I'm going to talk about today is part of the outcome of a Chief Scientist Office funded study, which was looking more broadly about long COVID from a primary care perspective and access to long COVID services through general practice, because we know from a variety of work that's been undertaken to date and from listening to people with lived experience that accessing and finding appropriate support, rehabilitation, treatment for long COVID is very, very challenging. So the work that I'm presenting is only a part of the bigger picture of the CSO study that we have undertaken. The part which we're not going to speak so much about because we don't have time today was led by colleagues at the University of Glasgow, where the study was based, who were doing an interview study with people looking at long COVID. Our work built on a survey that we'd undertaken at the very beginning of the pandemic around long COVID services within the NHS and third sector organisations more broadly. So hopefully I'm going to go to the next slide, put my mic up. So to this audience, I don't really think I need to explain what long COVID is too much. Many of you are living with the condition. Many others have got experience of supporting and treating people with long COVID. But it still remains to be a condition which is being understood. There's a lot of questions, although we're understanding more and more about long COVID, there still remains an awful lot of questions about its etiology and about how best to support people with long COVID. But we do know, and you know, that it has a significant impact on people's lives. And from the earliest time of the pandemic, we undertook a very light touch survey, I would say, across all of the different health boards, which was published back in 2020, about all of the different health boards, asking what their long COVID service provision was at that time. And together with colleagues at RGU and elsewhere, in another study, we looked at what makes long COVID rehabilitation work best, what are the best models from that. And during that time, it was really, really striking because long COVID service delivery across the health boards in Scotland were changing dynamically all of the time. Services being funded, then not being funded, new services started. Different services have different ways of access to them. So it was a very dynamic and unfolding picture. And in the financial landscape that we sit in at the moment, that remains the case. But we thought it was important to revisit that survey to look again in depth at what's being provided for who and where across Scotland, to try and understand that, but then to try and enable greater access to that information to people living with long COVID so that they can really get the best possible services that are available in their area if they're there. Most of the services back in 2020 were provided either face-to-face or digitally. Most of those involved occupational therapists and physiotherapists. Some of these you could get through referral from your GPs, through hospital, and a few through self-referral. And community rehabilitation was at that point the main method of intervention for people with long COVID in Scotland. In developing the survey, so what we undertook was we surveyed all of the NHS health boards, but we also went through social media. We went through our list through the Scottish Government Working Group for Long COVID to access all of their services. Really, it's through the net as far and wide as we possibly could to try and gather information about the types of services which exist within Scotland, not looking at private healthcare services. So we excluded private healthcare, and we're aware that there are some people who have accessed private healthcare services, but this survey did not look at that group. But it did look at health and social care and third sector provision for long COVID. And people, once we'd identified the services, people were asked to describe the service provision that they have within their health board area, and also to tell us what the catchment of that service is. So some of it was national, some of it was regional, some of it was quite local. And in order to collect that information in a structured fashion, we used a framework which is called the TIDIER, which is an intervention development framework to help researchers and clinicians describe what an intervention is. So you can only study something if you know what you're studying. And the TIDIER framework is an approach. It's very, very, you can see it in front of you just now, it's very self-explanatory about really categorizing what an intervention, and within this context, a long COVID service can be seen as a form of an intervention, what that intervention comprises. So it asks things like the name of the service, why it's there, what the goals are, what's provided, who it's provided to, how it's provided, where it's provided, when and how much. The last part at the end is to do with tailoring, it's to do with individuality, and then the checklist goes on to ask things about how it's adapted, but that wasn't relevant for our survey. These criteria, these categories are what we were asking each service to describe. So we got uniform information from each of the services that responded to our survey. The survey had two parts, really. The first was that one that I've just described just now, where long COVID service providers filled in what their service looked like. The second part went out far and wide, and we asked members of the public in general practice, other healthcare providers, what services they were aware of. We also asked at the end of that question what their experiences of these services had been, and I'll come on to talk about some of that towards the end of this presentation. That was part two, was really primarily about us trying to map and discover as many of these services as we possibly could. So what did we find? Well, in effect, things have changed since our initial survey in 2020, but not hugely, if I'm honest. We are not suggesting that this is an absolute complete representation of every service that exists in health, social care and the third sector, and presenting this before people have said, oh, there's this service and that service, and we're adding to this as more information becomes available. But the responses we got described 17 services across Scotland. We didn't get responses from the island health boards, so from Western Islands, Orkney and Shetland, but we know that from some of that was because there were no services in those areas. 17 services were responded to and described. Most of those services were for adult only, nearly all of those services. 2 were for both adults and children. And a gap which has been aware throughout the whole of this experience of long COVID is that there are very, very little services for children in particular, despite the needs for that population. And none of the respondents to our survey were for children-specific services. The majority of the services provided across these health boards, and you can see on the map where these are and where there were one service, or in a couple of health boards, multiple services. Multiple means two. The majority of these were accessed through primary care, some through hospital, and some you could self-refer them to, but by no means all of them. The what of long COVID service provision, what do these services look like, hasn't changed an awful lot since our initial survey back in 2020. The majority of these services still provide or describe what could be broadly talked about as rehabilitation services. You have to remember that rehabilitation is a much broader concept than just a physical rehab that you would get perhaps after you've had a stroke or cardiac condition, something like that you might typically think of when you hear the word rehabilitation. Rehabilitation within the context of long COVID rehabilitation is also helping people to live as well as they can with their condition, and making sure that they use appropriate interventions which are not going to fatigue people with long COVID more. So the majority of these rehab services were multidisciplinary in nature, still by far mostly looking at physiotherapy and OT, but also a range of other health professions in there. Some were condition-specific services for pain, respiratory, speech and language, or mental health. One was a charity providing various different types of support. One was a digital pathway, which I think will be known to many of you. And one specifically looked at vocational rehabilitation. But the picture isn't very different to what it was like in 2020. What's changed is where these services are available, because some have come and gone in the period since our initial survey. The range of symptoms that the services that responded to our survey reported dealing with, I think will be recognisable by many of you. And we know that the symptomology and the symptomatic presentation of long COVID is really extensive and very variable from person to person, but there are key clinical symptoms that come up time and time again with the people who are accessing these services, and they present around the issues you can see on your screen here. I think there's not a lot of surprises there. Interestingly, to look at how these services were provided, we didn't get a rationale. We didn't ask for the rationale for this, but we did ask what was the mean number of sessions and the range of sessions that were provided. How long did these last for? How were they delivered? What did they focus on? And typically, services responded to say that they would see people for between 6 to 10 sessions, that each session would last between half an hour and 60 minutes. There was a range of the way in which the services were delivered. So the majority would be individual, but there was some self-management and some group work thrown in there as well. The focus tended to be on interventions such as helping people to manage their energy better in a more effective way, to support them with breathing, with their pacing, a lot of work to do with mental health, an awful lot of work which all of our research to date has come back and strongly shown to be a very helpful aspect to the whole supporting people with long COVID has been this issue of validation, recognising just how challenging living with this condition has been, and emotional support surrounding that. All of the services reported personalisation, and that they would do their best to make this person specific, to focus on their goals and the value-based approach of a person-centred approach. There was a degree, although I wouldn't say it was universal, around vocational help. This was mostly linked to occupational therapy interventions and helping people to have reasonable adjustments at work as well, which I think is a growing area of research and practice for people with long COVID who are trying to either maintain their employment or return to employment. As I touched on before, the range of clinicians dealing and working these rehabilitation teams stay pretty stable to our original survey at the very beginning. So predominantly looking at rehabilitation professionals such as physiotherapists, occupational therapists. The key gap in all of these teams, and it comes up time and time again in different research that we've done, is the lack of medical input to some of these teams, or the lack of connecting to medical input. So you can see there that Some of the centres had access to physicians and medical support, but the majority did not. That has been a key point that's been pointed out time and time again in different studies, is the importance of having that medical support also for diagnostics and referral into other specialist services. So in summary, there remains a high variation in service provision and where that's available across the NHS and health and social care in Scotland. Service numbers and how people access that varies significantly from area to area, and a lot of that is to do with how well connected the local services with the local primary care service and how people can access and get that referral route. One of the key things that's come out from a variety of studies that we've done are GPs often don't know how to access long COVID services and long COVID rehabilitation. I often use the analogy of a GP being in a big room, and in that room there are many, many doors, and some of the doors are really well labelled. They say things like X-ray or stroke care or cardiac care or cancer services, but many of those doors don't have labels on them. Behind each of those doors, there is a service, but the GP doesn't know how to get that service because they don't know there's no label on the door to tell them where to go. So there's a piece of work to be done to support primary care, to know what services are available. And towards the end of this work, towards the end of this presentation, I'll explain what we've been doing to try and improve that information at a primary care level. Also to empower and enable people living with long COVID to be aware of these services so that they can take that information to primary care as well. We're in an evolving landscape. We've always been in an evolving landscape throughout the whole COVID and long COVID pandemic, and a lot of the uncertainty around funding still exists. And so we can't say what's going to happen in the next 12, 18 months. However, services did report different stories to us. So some of the services reported that they thought their service might close down quite soon because of lack of funding. Others were hoping to expand their service provision to paediatrics, and we're looking at staff development and looking into pain management and other conditions as well. So across the NHS boards, there wasn't consistency, despite the uncertainty of the funding landscape. There wasn't consistency of what the next steps were going to be. In this next section, we thought we would share with you some of the comments from the work with people living with long COVID that they gave us. When we asked them to identify services, we also asked them about their experiences of living with long COVID. Many of this will resonate with you and resonates with an awful lot of other research which is happening in practice at the moment. So I think what we do have is a growing body of evidence to show the challenges of service availability and access to services. So whilst none of this is a resolution of these issues, I think we do now have a really growing body of evidence which highlights the problems and the necessity of dealing with this. And all of the researchers are working quite closely together to try and make that policy impact, for us to share our findings with policy to try and improve practice. So, a common theme was people feeling unsupported, unable to access services and feeling very unsupported. Issue of service availability within the central belt of Scotland. If you're out with that, it's very challenging. It's not quite limited to that, as our survey shows. There are services across mainland Scotland, but certainly the island communities are underserved. The challenge, this is partly connected to the lack of a medical focus, but the challenge of having a medical focus leaves the access to specific services really, really difficult and primarily focused through general practice. So people feel invisible and that they can't access these specialist departments. Somebody described it, trying to find out how to get into long COVID as investigating a secret service. And we hope we've done something to uncover some of these and perhaps not completely resolve the challenges, but make it less like investigating a secret service. Some people felt that the GP was very, very supportive. Others reported that they had not had a positive experience in general practice. But because of the lack of services, people have been resorting to using private services as far as wide, apparently, as looking for a service provider in Australia. That's obviously something which, I feel, as researchers feel, should not be necessary. You should be able to access your services through the NHS. So what can we do to support that? And people feeling adrift because of the lack of connection. So this data supports other work, supports our interview studies that we've been doing with the other half of the study, and several other studies which have been going on into the lived experience of long COVID. And I think a lot of it will resonate with you, people feeling as if they're dumped, this person says, dumped on a scrap heap. And there's emotional trauma connected with this, all of which highlights the importance of really improving access to and the development of appropriate long COVID services. Multiple challenges in really accessing long COVID treatment. First of all, getting an appointment, finding a GP that will believe in them, and finding a GP that is aware of services, this room with the doors that I've spoken about, this cycle of going through diagnosis after tests and then getting a referral can be challenging, and being treated by a service provider. It's multiple hurdles along the line. And when we presented this work in a workshop similar to this a few weeks ago, we had a fantastic graphic scriber from Nifty Fox who works with us, who summarised the sorts of challenges that people living with long COVID are facing. And some of that is even about accessing the GP appointment. You know, you can't always call at 8 a.m. in the morning because your energy levels are just not there to get up at 8 a.m. in the morning and go through that long queue that many people report having to experience in primary care. A whole range of challenges along the way. And future research that the research teams across Scotland are now looking at is how we can pull this together to try and make improvements for provision in the future. You can see there a whole range of challenges which people with long COVID, from the findings that we reported similar to today, came out and told us about. So what have we been doing to try and improve accessibility to long COVID services? Well, Cameron's going to come on shortly and speak to us more, but the Local Information System for Scotland is a fantastic resource which collates information on a whole range of services which are available within health and social care and broader within Scotland. And you can search it, Cameron will explain much better than me, but you can search it through conditions or you can search it through your local area. All of the services which we have retrieved information about within our study, within our survey, and we've been working closely in collaboration with Cameron, with Jackie and colleagues to upload all of that to ALISS, to the Local Information System for Scotland. And that information is now there available, so you should be able to search within your area for what long COVID services are available. And we're in the process of developing a study website which will report all of this information and have a map on it, so you can hover over your local area, click on your area, and see what's available from long COVID in that. So we continue to collaborate really closely with ALISS, and I'll finish now. Jackie, if there's times for questions, I'm happy to take that, or we can go on to Cameron's piece and then take them afterwards as you wish.
Happy to take a couple of questions just now, as it's been quite a few bits of activity. Quite a few you've answered already, Eddie, you'll be pleased to know. So there was quite a few comments just around did the survey show or be able to tell how many kind of medical doctors were part of those MDT teams, but I think you did touch on that. I don't know if there's anything else you wanted to add on that around, did you get any kind of idea of the kind of percentage of services that had kind of medical?
We had 17 respondents. I can't remember off the top of my head which one, so unfortunately I can't name to you today which services had the medical input. I think that will be available if you search the information on it will be able to tell you what's available per service if you look on ALISS. We had 17 respondents services, and we had 5 of those who said that they had medical input. None of those, to my knowledge, has a dedicated physician attached to it, but it will be people who have got access to a physician. So I think I'm correct in saying that none of those will have a dedicated physician, but 5 of the services reported that they had access to physician support for that. The remaining did not.
Okay, right, another question around how this work and the findings of your work are being fed back to the NSS Long COVID Strategic Network and Scottish Government, if that's happening, and if so, how?
Yep, and you can see that Hannes there has also said that there's no physicians core funded, which is in line with what what our survey showed. So we're writing policy documents. We have very good links into, there's a whole long COVID network at Scottish Government, and I have to say and give them absolute credit that they've engaged very well with us on this, and that we've reported our findings to them. The bigger study as well of access to primary care is being fed back to them as well. Obviously, we can only try and influence and inform what happens at a Scottish Government level, but they're very well informed of what's happening.
And lastly, there's a few comments coming through that the long-term conditions strategy consultation paper launches today, and just if there's any implications of your research and feeding into that consultation, just given the potential links there.
Yeah, so we'll certainly be feeding our results into that. I think there are real lessons to learn which are broader than just the long COVID service around accessibility and information. Not in this study, but in a parallel study which we conducted, Chief Scientist Office funded study, which looked at evaluating different models of long COVID service provision. There were really stark differences in how services and primary care work together. Some health boards did not have a proactive engagement of publicising the pathway, so that certainly, they would report and say, yes, long COVID services, long COVID rehabilitation exists, but there was not a proactive communication to primary care as to how to access that service. And it is a developing and an evolving service, so general practitioners couldn't know necessarily what was available for them, and what was being developed and available for them. In some health board areas, the health boards took a very, very proactive approach to publicising that pathway to primary care. Where that happened, the referral rates were exponentially higher to the health board areas where that did not happen. Okay, some of our health board areas which had more integrated services, so not specific or dedicated services for long COVID, I think worried about having a landslide of referrals. So possibly didn't proactively publicise that pathway because they were really concerned about services which were, to be honest, already chronically underfunded, being swamped with referrals. And whilst ethically, at a personal level, I struggled with that decision. You could also see the rationale for it, because in the services that did proactively publicise the pathway, that exponential rise in referrals was really hard to match with service provision. In fact, the services, did become swamped when they publicised the long COVID service provision. So there are real challenges there to do with, what's the quality of the service you can actually provide versus making sure that everybody knows that they're there.
Well, thank you, Eddie. It's been a pleasure. We'll pass on now to Cameron to tell us a bit more about ALISS and how to access the information, and then we'll take a few more questions at the very end. So there's still opportunity. Any more questions, just add them to the Q&A function and we'll pick those up as best we can at the end, and any that we don't get to, we'll absolutely make that commitment to get a response for you. So with no further ado, I'll pass over to Cameron to tell us a bit more about the ALISS platform.
Thanks, Jackie. Hi, everyone. It's nice to be here this morning. As Jackie says, I'm going to give you a bit of information about ALISS and how it can help people to find some of the services that Eddie and the team at the University of Stirling have been mapping. Eddie mentioned that they've uploaded those services onto ALISS, so they are now visible through the ALISS website, as well as then through various other places as well, as a result of being on ALISS. So I'm not going to speak for too long, just about 10 minutes or so, and really I'm just going to show you the ALISS system, and I'll give you a wee bit of background to it, but I'll just show you basically how to go on, how to search for information, and how it can hopefully support this type of work. So I'll just share my screen. Okay, can I just check that people can see that okay? Yep. Jackie, can you just shout if you can see that okay? That's great, thanks. Right, so again, I can't see any chat or anything like that, but I will carry on, and if anybody does have any questions about ALISS or anything demoing here, then just I put them in the chat again and we can hopefully pick up on that as well. So this, as you can see, this is the ALISS website, a local information system for Scotland. So ALISS is funded through Scottish Government and it's managed by the Health and Social Care Alliance. So we again are just one programme within the Alliance, and some people might be familiar with ALISS already. Some people might never have seen it or heard of it, which is fine. So I'm just going to give you a bit of background first. ALISS has been around for quite a while. It's been around, it was initially kind of developed way back like 2009, 2010, and there's been various different incarnations of the site and the system since then, and the programme's grown since then. But initially ALISS was all co-produced with people who were living with long-term conditions or who were disabled or providing unpaid care, as well as with a variety of different health and social care professionals as well. And the aim of the programme is basically to help people to find and also to share information about the whole range of different support services, resources across Scotland that can support health and wellbeing. And that's about health and wellbeing in its kind of broadest sense. So ALISS includes all sorts of different information, and there's various different ways you can search that. So this is the homepage here. You can start your search in a couple of different ways. You can choose to search either maybe whereabouts you want to look for something. So if you are looking for something in your local area, then you can put in a postcode, or you can just type the name of the place or the town or the city, and you can search on that basis first. Alternatively, if you want to, you can search for the type of information, type of service, or type of resource activity you're looking for. So if you switch over to the what search, then you would just type in the keyword or topic that you're looking for. And it doesn't really matter too much because you can filter by each different way once you're actually into the search results as well. But just for this one, I'll do the what search just now. So I'll just show you actually, if I don't search for anything, then within ALISS there's over 6,000 odd results, and you can see just the kind of range of different things that are listed in here. So it's a broad range, as I say. So it's not limited to long COVID. And resources obviously can include that. So if I go back and I could search for long COVID as a keyword in here, which I'll do. You'll see here that it still comes back here with like over 1,000 results. That's obviously, there's not, unfortunately, that many services supporting people with long COVID in Scotland, but the reason it's coming back is it's just based on the keyword. So it's searching for things with COVID or long in the title there. So you're seeing all the long COVID stuff, but also a lot of stuff that is just got the word long in it. So probably an easier way to search maybe would just be to limit that, say, to COVID. And here, again, it kind of whittles it down a wee bit. So here, there's 52 results brought back just on a keyword search for COVID. So that might be a starting point. You can go in and you can see these are the things that are currently listed on the ALISS page that contain that keyword. Again, similar to what Eddie was saying earlier on in terms of their survey, this is not to say that this is absolutely comprehensive, every service that exists in the country, but this is currently what is available for people to find on the ALISS platform, and that does include all of those services that Eddie and the team at University of Stirling mapped and uploaded, as well as other information that have been added by other people, including organisations themselves who are providing support and services around long COVID. So just to explain that quickly, you can see here that some of the information will say it's claimed, others don't. So the information that's claimed, that means that the organisation of the service have basically gone on and they've taken responsibility for managing and maintaining that information. So they've got editorial control over that information. The ones that aren't claimed, that's stuff which has been added, well, mostly again by Eddie and his colleagues, but potentially by other people who are also maybe involved in either mapping information or who as part of their day-to-day work might be gathering information for their own purposes, maybe in terms of signposting others or for other reasons. And the whole kind of purpose of ALISS really is about trying to make information more visible, more available, but also to reduce the amount of duplication that's out there in terms of information. So reducing the information, but also reducing the effort and the time and the resource that goes into gathering and maintaining this, and trying to make it easier for people to keep information up to date as well, rather than people having to go and maintain their information in lots and lots of different places, which is hard to do. It means that information's scattered all over the place, which is a challenge for people when they're going to search for that. So this is what the information looks like on ALISS. That's just based on a keyword search. There are other ways you can filter and sort your information on here in terms of how you might want to go on and filter this down. So I mentioned earlier, you could actually filter by your local area. So you could put in a postcode in here, or you could type a place name in here, and you could then look at what's available in that local area. And there's other ways as well. You can sort it by what's been last updated, or just A to Z, or what's been added most recently. You can also go down and you can filter by category as well. So currently, as I say, this is just a search on the word COVID. So that will obviously include all of this information, but it might include a few other services which might mention COVID, but not necessarily be a long COVID service. So one of the other ways you can go in and filter information is through actually a categories filter as well. So if you go into the conditions filter, we do have a long COVID category. And if you click on that one, then again, that will kind of slightly reduce the number of results. So it's down to 36. Now, and that's things which have been specifically assigned the long COVID category when they've been added into ALISS. You can then click through to see more information about these services. So if you click in, then you can get a wee bit of information about it. You can share this page with people. If you're looking for somebody else, you could share it via email, or you could print it off for somebody, or you can obviously print it for yourself. You can see the categories that it's been assigned. You can help to keep the information up to date as well. So anybody, if going on to ALISS, you can click on this help us improve this listing button. If you notice something that maybe you think is now or anything inaccurate at all, then you can click on the improve this listing button, and you can tell us basically what needs to be updated on that. And either we can do it at our end, or if it's claimed, we can pass it on to the organisation or the service themselves, and they can do that. So I'll just quickly again scroll down and give you a look at the different types of things that are there. So again, a lot of the kind of more formal services. Again, I think all of these are stuff that Eddie and the team have added, as well as other maybe more third sector and community-based type organisations as well, who are providing different types of support and activities around long COVID. So here's one here delivered by Scottish Ballet, which is about dance-based support. And again, you can click in, you can get a bit of information about it. You can get back up to all the contact details, and there's also other bits and pieces of information that you can add when you're uploading information into ALISS, such as different accessibility features that the service offer. So that's kind of how it looks on ALISS. And again, really, ALISS is just a mechanism, a kind of space and a mechanism for people to be able to make this information more available, and to get involved in a kind of collaborative way in gathering and maintaining it. But the other side of ALISS is that once information is on here, it's then automatically available to other places, other websites or systems which want to take the ALISS information and display that via their own sites or systems. The idea being that different people will go to different places to look for information. And again, that's what people had told us when ALISS was originally being developed, was that people, well, they won't necessarily know about ALISS, and even if they do, they might be directed to different places for various different reasons. So what people had initially said was that they needed to have the same kind of list of results and information, but they need to have that from as many different places as possible that different people might go to. So just to give you a few examples of these, I'll run through a couple of other websites which take this information from ALISS and display that via their own platforms. So the first one here is the NHS Inform website, which I'm sure people will be familiar with. That's obviously the main health website in Scotland. And so on here, you've obviously got all your information about illnesses and conditions and things like that. They also have a directory component of their website called Scotland Service Directory. And if you click into the Health and Wellbeing Services section here, you can see that a lot of the information here, it will say where it comes from, and a lot of this is pulled through from ALISS. So as well as information they get directly from other places, on here they display ALISS information. So you can go in and you could again search on the directory here, or even if you just did a search up here actually on the NHS Inform site for long COVID. So initially you'll get the results for all the different kind of articles and resources about what long COVID, what it is, etc. But if you click into the View Services tab, then again, if I scroll down here, you can see this is showing a lot of the services that's been added onto ALISS and then is automatically pulled through onto NHS Inform. So this means that somebody can go into NHS Inform, if that's the place they go for their information or that's where they end up, then they can still find the information added to ALISS without having to know about or go to the ALISS website. And again, if I click into the information on here, this is all displayed in the format of NHS Inform, but this is all ALISS data, basically, that's been automatically pulled through. And it means if the information is updated on ALISS, it's automatically updated here. So again, it saves organisations having to update their information multiple different times. They can do it once in ALISS and it will be automatically updated in any of the different places that are taking the data. So that's one national example. I won't go into these ones in lots of detail, but there's other local sites that take ALISS information as well. So this is the North Ayrshire Community Planning Partnership website. They've got a directory on here. Obviously, it's kind of to do with North Ayrshire. But again, you can search on here for information. And if I go into long COVID, initially there's only a couple of things come back because it is filtered on North Ayrshire, but I can then go in and I can ask to show all services, not just the local ones. And again, that'll take me back and it'll show all the kind of national resources as well. So again, this is all the same information. It's all coming through from ALISS, but it's displayed in this website here, which if you're in North Ayrshire, this might be the place that you find yourself looking for information. This is another one up in Shetland where this site has been developed by the teams up in Shetland, and this is a place that's promoted to go to. So again, if you are based in Shetland, you might go on here and search for information. And again, unfortunately, as Eddie had mentioned, there was not really a lot of services up in Shetland supporting people with long COVID. But if you then change that filter, you can at least get the national services that are available kind of regardless of whether you're in Shetland or the borders or whatever. And so again, that's all ALISS data. It's the same stuff. So again, if this service is updated on ALISS, it's updated across all these different platforms, and it just means it's more findable for people through the place that they're going to as well. So I will stop sharing there. I think that's me. I'm back. So I'll stop sharing, and as I say, I couldn't see any questions, but I do see there is quite a few questions.
Yeah, there's a few questions for you, probably for both of you, probably in relation to ALISS. The first of which is, obviously Eddie alluded to that this is quite a changing landscape. You've touched on some of the ways that ALISS can be kept up to date, but just really about how will ALISS keep up to date with those changes, particularly in the kind of long COVID landscape. So I don't know if that, maybe for yourself, Eddie, is there any plans for a repeat of the survey or updating the information? And similarly, Cameron, you've already touched on some of the ways that those who claim those services can keep them up to date. So I don't know, over to you guys first.
Thanks, Jackie. So obviously one of the limitations of doing a survey is it's cross-sectional. It only is asking the question of what services are available at that specific point in time. And we've repeated it twice now, once at the very beginning of the pandemic as long COVID services emerged and the condition and understanding of long COVID was beginning to emerge. And more recently, within the last few months, we have no plans or funding to repeat that again. And I wonder how useful it would be to do it within a short period of time. The connection with ALISS, I think, is really, really helpful, though, in looking at trying to keep information about this updated and communicated, importantly, on an ongoing basis. Now, one of the ways, when we uploaded the information, we let all of the health boards know and the services know that we were doing that. And we only uploaded it with their permission. To my knowledge, nobody said we couldn't do that. It was one of my colleagues who was doing it, but I'm unaware of any service that said we couldn't do that. We also asked the services to claim as Cameron's described, to claim that information. And what that will enable them to do is to update it as changes happen in practice. I hope new services become available, or for instance, if those greater medical input and any of those who, what, why, where, when and how questions are being, if those changes in that could be updated on ALISS and people would have the most up-to-date information. We can't make services claim that information. and we've told people how to. I can see some names that I recognise, and perhaps there are others I don't, from health boards and perhaps long COVID services here today. So my request to them would be, if they've not yet claimed that information, could they do so? It will be a way of enabling their population, primary care, and the general public to know exactly what's available and how those changes are happening. So that the most effective route from now on will be for the health boards to claim that information that's been uploaded, because our information is only up to date at this moment in time, and everything that we know means that in 3, 4, 5 months' time there's going to be changes.
Yeah, and I suppose all I could do is offer some kind of reassurance in so much as here at Health and Social Care Alliance Scotland, like my team that supports the kind of long COVID work, and Cameron's team, we'll be doing our best as well to encourage those services to claim that information, because I think you'd probably agree, Cameron, that's probably the best way to make sure the information stays up to date.
Yeah, definitely. I mean, that is definitely the ideal scenario, when organisation services claim their own information, and it means that they can manage that as and when something changes. They don't need to wait for somebody to go around every 6 months or a year or whenever it is to check if things are still as they were described. They can make sure that things are reflected kind of how they want it to be, but if there's no say, it's a phone number changes or whatever, then they can just update that. Or if a service starts or stops, they can manage that in real time, basically. And again, it is then automatically updated on these other platforms that are using the ALISS data, as well as just the ALISS website itself. So hopefully does save people a bit of time as well if they're doing that, rather than again having to do it multiple different places. We're also happy to support with any of that. If anybody is looking to find out how to claim, there's information on the ALISS site. There's guidance videos and all sorts of stuff on there, but we're also happy to speak with people, and we can run through how to do that. And yeah, we can maybe kind of follow up with people as well who have been contacted, if that would be helpful, so we can maybe have a bit of a chat with Eddie around that as well, going forward.
And just Jackie, just looking at some of the comments feeding back, so some of this is really challenging because there's multiple levels to the barriers that people living with long COVID are facing in accessing appropriate care. And obviously, one of those, people have reported, to be fair, people have reported very, very positive relationships with GPs, yeah? And others have reported relationships which aren't as supportive. And sometimes the GPs who are supportive just don't know where to send people as well. So there's multiple layers to the barriers that are faced. And Claire Ratty, hello Claire, has highlighted one of these, which is where you feel you're stuck in a bit of a vicious circle where the GP says nothing's available, the GP says the health board says nothing available, but you can see this information. Obviously, it's to do with the relationship, and you have to approach this, I think, in a constructive, collaborative partnership approach with your GP. But I'd be hopeful that you can now go back to them and say, well, look, this is the information that is available on ALISS. That says how you can refer to me. If you're willing to do it, could you give this a go? Because the service is there. It's just that it's not well publicised.
I'm conscious of time, so I'll take a couple more questions and just assure people we will review all the questions and all the comments in the chat to get a response, which we will publish alongside when we share the recording of today. But just a couple of comments around, the links between long COVID and ME and chronic fatigue syndrome. And really, when searching for services on ALISS, it's just kind of getting the right search term, I suppose, and if there's kind of benefit about searching wider than long COVID, around services for chronic fatigue and other services, and if there's a good kind of catch-all kind of search term that would bring up all those types of services.
Cameron, do you want to talk about search terms? The other question I saw, which Cameron you might want to reply to, is something about whether any of these services are vetted before they go on. Now, obviously, I've put up health board services, but I think they were talking about more general types of services which are uploaded.
Yeah, so just in terms of the search question first, yeah, it is possible that it might be worth searching for other terms as well. Obviously, you could start by searching, say, COVID, long COVID. You can look through the various different filters, and again, you can search based on your location as well. But you certainly, it wouldn't do any harm, I guess, to maybe try some other keyword searches in there as well if you think there might be other things which would potentially be useful. We do use kind of synonym matching, and we're always trying to make improvements to the kind of search functionality within ALISS to try and bring back as relevant results as possible for people. But yeah, there might be more like wider services or resources in there that might not specifically mention long COVID or COVID within the description that you might find using other terms. So certainly you could have a browse around, and the whole point really of the information analysis that there's such a range of stuff out there which can actually help people to live well. And it's not just about those maybe specific services, although obviously they're important. There might be other stuff in there which could contribute to supporting overall health and wellbeing as well. So it might be there's other stuff completely aside to any long COVID stuff which might be of use in ALISS as well. So feel free to have a search around there. In terms of checking the information coming in, there's different ways that information can go into ALISS. So there's different types of accounts, and it kind of depends in terms of the account that's adding it. So if it's just through a kind of normal account, then it does have to be checked by us first before it's published to live. So we would check it. I mean, it depends what is meant in terms of vetting, I suppose. So we don't go out and investigate kind of services as such, and we check that the information kind of appears correct and that it's appropriate in terms of what it is, what the service is for ALISS. But there's a whole variety of terms and conditions that you can go on and kind of look at if you want to as well, around about kind of criteria for how things can or can't be included in ALISS. But so there are things that we maybe wouldn't obviously publish that might be submitted, but we wouldn't go out and vet services, I would say, in terms of actually going out and going into that level of detail. Again, if people claim information, then we do verify first of all that it is somebody from the organisation or the service that's claiming it. We do have contact details for them. So there are various kind of checks that we would do before things are made live. But it is obviously a kind of crowdsourced system. And yeah, we wouldn't be kind of going into like lots and lots of detail about each individual service. That's kind of beyond our role, really.
No, thanks, Cameron. I think just to end, there's a couple of kind of probably more general questions that probably for yourself, Eddie, just around, was there any data from either this work or some of the other work that you guys have been involved in around disengagement from services?
Of people who've been referred to and then disengaged. So this study certainly didn't look at that. One of our other studies, which looked at what models of long COVID service provision work better, interviewed a lot of people who'd received that. So we have got data on that. I'd have to go and look at it in depth to speak accurately about it.
Okay, and then lastly, somebody commented, is long COVID now classed as a disability? Just, I think Ali's been beavering away in the background just to find that the Equality and Human Rights Commission did issue a statement that long COVID can meet the requirements of the Equality Act. I don't know if Eddie, if there's anything you want to add in that regard.
I've seen that as well, and I haven't seen other confirmations of that, but yeah, I've seen that statement as well. So I think that's as far as it's got at the moment. Margaret, we're working on a publication at the moment. The original survey is published, and if you bear with me, I can put it in the chat in a couple of minutes. The other survey we'll make widely available and let ALISS, let the Alliance know when it is published, so you'll be able to see it there too. Hopefully that won't be too long. I'll just see if I can get the original survey, but bear in mind this isn't the up-to-date survey I've been reporting today. That will be reported, I hope, published soon.
Thank you so much. But spot on time for once. So I just want to extend, I'm sure from everybody that's came along today, our thanks to both yourself, Eddie and Cameron, for your presentations and for sharing information in such a kind of open and honest way today. And also many thanks to the National Services Scotland Long COVID Strategic Network, but especially the Lived Experience Engagement Group, who we're linking with and who have helped bring this webinar together today. But most of all, thanks to all you guys for coming along today. We know that sometimes is a challenging ask for you guys. So to take an hour out to come along today, we really wholeheartedly appreciate it. As we said at the beginning, we will make the webinar publicly available, which will be likely through the Alliance YouTube channels, but we'll let you know when that's available. We'll also collate all the questions and all the chat, and we'll pull all that together and produce a response. And any questions that we didn't quite get to, or anything we didn't pick up in the chat, we will get back to folk on that through a response in the next week or two. We'll hopefully do that as quickly as possible. We do hope that this is the first in a series of webinars, and we do hope that the second webinar will be advertised fairly soon. And that focus of that second webinar is likely to be the practical supports that are available from some of the third sector organisations, some of which were mentioned today. So just bring it all to a close now, just again to thank you all so much, our speakers today, and don't hesitate to get in touch with either Ali or myself. We have a generic email address, which is longcovid@alliance-scotland.org.uk, that you can get in touch with us directly, and don't hesitate to do that. But we'll certainly be keeping in touch, and we'll link with both Cameron and Eddie to make sure that we get full response to all the comments and questions in the chat. So thank you all so much, and hopefully we'll get to engage with you again at our next series of when we have our next webinar session. So thank you all so much.
Thanks, Jackie. Thanks, everyone. Bye now.